I've been using lasers to treat varicose veins for quite a long time. I first started using them in 2002 and I've done several thousand cases. But what we're using now here at Lewisham Hospital is a technique called Clarivein, which is one of the latest techniques to be developed in the United States.
I had heard about the procedure on the internet. Obviously laser surgery and Clarivein being new procedures were much more beneficial, and also it means I had much less time off work. It was originally just the appearance, but as about 2 years ago, 18 months, it started to become much more painful. So being an active mum and working, it was hindering a lot of the things I could do.
Right. To date, we've been using this technique here since July 2010, and we've done approximately 60 cases so far, with some very good early results. The Clarivein works by having a small wire which protrudes at the end of a very thin catheter, which is the sheath that goes up the inside of the vein. We position the catheter in the right place at the top of the leg, and then the catheter is attached to a small handheld motor. When we pull the trigger of the motor starts the catheter spinning, and the wire at the end spins around very, very fast at around about 7,000 RPM. As we draw that rotating wire back down the leg, it becomes in contact with the inside lining of the vein, and it just scuffs it up and slightly damages the inside lining of the vein, so that when we then subsequently inject the drug, which comes out at the end of the catheter tip, it makes the vein close down. In medical terms we call it occlusion, and the vein just becomes a sealed tube rather than a hollow one which is full of blood. We've been amazed by how quickly patients get better. They have almost no pain afterwards. One or two of them may need to take paracetamol for a day or so, but there's virtually no pain afterwards and almost no bruising. Today I'm seeing Nicola Dye in my clinic. It's now about 6 weeks since I operated on Nicola's right leg varicose veins using the new Clarivein technique. Hello there. Nice to see you again, Nicola. Come and have a seat. Nice to see you.
Thank you.
Right, now it's about 6 weeks since your operation on your right leg. The first question I ask everybody at this stage is how much pain did you have after it?
I didn't actually have any pain.
Okay, none at all?
None at all.
The operation was entirely straightforward. It took about 15 minutes. She didn't have any pain at all during it, and at a 2-week follow-up scan we've seen that the vein is now completely occluded, which is what we were expecting and hoping for. I'm fairly optimistic that she's going to get a good result and which will be durable.
There was a slight drilling noise. It's like being at the dentist. It was no more painful than that. It was just a case of the unexpected. Didn't hurt whatsoever. It lasted for about 20 minutes. And then after the procedure, I just got up as normal and walked out. That's completely come back to normal life. I don't have to. I literally go to work, come home, and it doesn't swell up anymore. It's just normal.